Thanks for joining me today on Bite Size Dental Marketing. I have Danielle. Danielle is one of the leadership on our call analytics program that they've listened to about 80,000 calls, and they disposition them to help us figure out the marketing, what's working, what's not. They also help the offices get into how their front desk is doing. Danielle, I'm so glad you could join me. I know that it's Namibia is a long way away.
Thank you so much for having me, Eric. So basically, I'm part of the call analytics team at Pain Free Dental Marketing. And how it all works is we have a platform where we track callers that call into the practices. And we use tags, really important tags that our dentists can have a look at to see what each call is about.
So if I was a dentist and I wanted to know my new patient calls that came from obviously the marketing numbers, because if they call the front desk, we don't intercept and record the call.
Yeah.
So I'd be able to go in there and filter by new patients and had a financial conversation and scheduled. And then I could also conversely look at new patients, had a financial conversations and didn't schedule, and use those for coaching for the front desk. That's correct? No. Now, how do you listen to the entire call? How do you, as you're listening, obviously there's there can be hundreds of calls in a month per office. Talk me through, when you start listening to a call, how do you determine if they're a new patient or not, or existing patient? And then do you apart from the tags, is there any other information you guys keep?
Yeah, so we've got our main tags, as I've discussed, things like financial, which is where patients discuss insurance or anything to do with finances. And then obviously new patient callers, existing callers. But then we also have a note section next to the tags, which is also where we keep imperative intent or existing patient. We always write down the number of patients calling in. So, for example, if it's a mom calling in to book 5 appointments for her family, we would write there 5 new patients or 5 existing patients or 2 existing patients and 3 new patients, just depending on, the.
Mm-hmm. No, I've seen the reports that you produce, and I really like them because I think for me, it gives me not only a broad insight into what's happening in the marketing, but also how the front desk is performing on, are they pushing back when people cancel? Are they, really selling the insurance question? Are they getting off the phone when they find that it's a wrong number, which ironically, that happens about 13% of the time. I think if you look across the whole data that we have, there's a shocking amount of wrong number calls. Yeah. And because the office names are so similar, sometimes they have trouble determining if it's the right practice or not. It's so crazy to dig in.